Well, good afternoon. Dr. Yaffe and Dr. Heyer pointed out yesterday, nearly 80% of the cases reported over the past few days are from regions now in the red control zone. Across the province in the last week, hospitalizations have increased by 22%. Intensive care unit admissions grew by nearly 50%. We are now teetering on the edge of having to delay scheduled surgeries. In fact, some hospitals like Scarborough Health Network have already had to delay surgeries. My friends, I've been clear on this. The situation is extremely serious. And further action is required to avoid the worst case scenario, where the rate of the community spread is greatest, the risk to our schools, our long-term care homes, hospitals is the greatest. We cannot put in-class learning at risk. We can't risk widespread outbreaks in our long-term care homes. We cannot risk overwhelming our hospitals. To protect our most vulnerable, to protect what matters most, we have to get the community spread under control. Since September, following the advice of our health experts, we've taken incremental steps. We've taken decisive action to slow the spread by introducing public health restrictions, increasing testing and contact tracing and enforcement. At the same time, we've invested billions of dollars to increase capacity in our healthcare system. These steps, they've helped thanks to our collective efforts. We've saved lives, but this virus, it spreads like wildfire. And in certain parts of the province, it's spreading at an alarming rate in the community. Last week, our modeling showed that if nothing was done, we could face 6,000 new daily cases in the coming weeks, overwhelming our ICUs shortly after that. More deaths, more losses, but we can avoid this if we take further action now. So after extensive consultation with the Chief Medical Officer of Health and the Public Health Measures Table, effective Monday, November 23rd at 12:01 a.m., Toronto and Peel will be moved into lockdown. Minister Elliott will walk you through the details in a moment. My friends, I know these past few months have been extremely difficult. COVID fatigue is setting in on all of us. But I've seen the strength of our people. And it's up to each and every one of us to determine our future, to write the next chapter of our history. And we all have a part to play. We must all rally around our businesses and our neighbors right now. We must support them. Our government will be there to do our part. We will spare no expense to support these businesses. Today, we're doubling our supports for business impacted by these measures. I've directed that up to $600 million in relief be made available immediately to help these businesses with fixed costs, including help with their hydro bills and property taxes. We will be there for these folks. Businesses can apply today for this relief and for PPE grant at ontario.ca/COVID support. And together, as a province, we can all make a difference. Please shop local. If you're shopping online, I know it can be easy just to go with Amazon. But please remember that you can buy the exact same product from a local store. Please buy from local stores. Please do your holiday shopping through curbside pickup or online stores. Support our restaurants and order takeout. And to be clear, grocery stores, pharmacies, big box stores will remain open safely with capacity limits to make sure you can access all the goods you need. So please, folks, avoid panic buying right now. I'm going to repeat that. Please avoid panic buying right now. There's no need to buy more than you need for a week or two. By avoiding the panic buying, We can make sure that supply chains are not impacted and there's enough for everyone. I know this is difficult news today. It's not where we want to be, but my friends, I have faith. Ontario will weather through this storm together. Please look out for each other. Please stick together. Because in this darkest hour, we see what we're made of. We see what we can endure. And we will endure, we will persevere, and we will get through this. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Our top priority has always been the health and well-being of all Ontarians. Despite the range of public health measures and restrictions that have been in place since early October, we've seen the situation continue to worsen in regions across the province, particularly in hotspots like Peel and Toronto. It's clear more needs to be done to limit community transmission of COVID-19 so that we can keep our schools open, safeguard our health system capacity, and protect our most vulnerable. As we've seen around the world, lockdowns are a difficult but necessary step to prevent COVID-19 outbreaks and bend the curve in the number of new cases. Based on the recent data, and to protect the health and well-being of people and families in these communities, Peel Public Health and Toronto Public Health will be moving to lockdown effective Monday, November 23rd at 12:01 a.m. Measures under lockdown include no indoor private gatherings will be permitted with anyone outside your household. Individuals who live alone may have close contact with one other household. Outdoor gatherings will be limited to a maximum of 10 people. Retail stores providing non-essential services in shopping malls can operate through pickup or delivery. Non-essential storefront retail can stay open for curbside pickup or delivery only. Restaurants must close indoor dining, but may stay open for takeout and delivery. Religious services and weddings will be restricted to 10 people indoors and 10 people outdoors. Gyms, sports facilities, cinemas, casinos, museums, and personal services must close. Manufacturing, agriculture, supply chain, and most construction can continue. These measures are being put in place to prioritize the essential services we rely on. Schools will remain open. Childcare will remain open. Grocery stores, pharmacies, doctors' and dentists' offices, and other essential services will remain open with capacity limits. Today, we are also announcing that the following public health regions will be moving into the following levels in our COVID-19 response framework. As mentioned, Peel Public Health and Toronto Public Health regions will move into lockdown. Durham and Waterloo regions will move to the red control level. The Huron-Perth, Simcoe-Muskoka, Southwestern, and Windsor-Essex Public Health regions will move to the orange restrict level. And Chatham-Kent, Eastern Ontario, Grey Bruce, Kingston, Frontenac, and Lennox and Addington, Peterborough, and Thunder Bay and District Public Health regions will move to the yellow protect level. These new classifications will come into effect Monday, November 23rd at 12:01 a.m. In addition, for regions in the red control level, the limit for all organized public events and social gatherings has been reduced to 5 people indoors and 25 people outdoors. To further protect the health and safety of those in long-term care homes, staff, essential caregivers, and support workers who provide direct care to residents in regions that are in the orange restrict level or higher will be tested weekly for COVID-19 beginning Monday as well. And to further support public health unit regions, we are making additional enforcement mechanisms available to local medical officers of health by amending Ontario Regulation 950 under the Provincial Offences Act. This amendment will allow tickets to be issued if public health measures set by the local medical officer of health are not followed. We will also work with the Chief Justice of Ontario to create an order establishing a set fine of $750 to any ticket issued. I know this is not where we wanted to be, but our government and Ontarians have risen to the challenge before, and I know we can do it again. And with the recent news about the Pfizer and Moderna vaccines, there's light at the end of the tunnel. But now more than ever, everyone must follow the public health advice and adhere to restrictions in your region. We will get through this together. Thank you. And I'll now invite Dr. Williams to please come forward.
Thank you, Premier and Minister. The discussions over the last few days have not been easy. Moving regions into more stringent levels is never a decision that is taken lightly. But recent data, trends in key public health indicators continue to worsen for many regions in the province, and we need to take action to ensure we are protecting the health and safety of Ontarians. We understand the significant impact these changes will have on individuals, families, and communities, particularly for the regions of Peel and Toronto, which will be moving into lockdown. But imposing these measures are necessary at this time if we're to reduce the transmission of the virus and address increasing health capacity challenges. We must also take these steps to reduce the impacts on our long-term care homes and other congregate settings, where some of our more vulnerable members of the society reside. Taking this action now will further help to ensure that our schools and childcare centres remain open, allowing our children and youth to continue to learning and growing in a safe environment. A variety of these decisions involve careful review of the data and productive conversations with the local medical officers of health. The input received from our public health units is vital for putting the trends and data into context. Our medical officers of health and their teams are our boots on the ground. They are working tirelessly every day to protect the health and safety of their respective communities. And the information and insight they can provide us is invaluable as our assessments are made and our advice is provided. The decisions with respect to which each health unit level would be moved to, we are supported by the appropriate local medical officer of health. And for Toronto and Peel, while the maximum measures being imposed is not what we wanted to do, we all agreed that it was the right thing to do. Ontarians have continued to demonstrate their willingness to follow public health measures to keep their loved ones and communities safe from COVID-19. We have flattened the curve before, and I am confident we can do it again. So thank you, and now I'll pass things over to Minister Phillips.
Thank you, Dr. Williams. All of us know a small business owner struggling due to COVID-19. We see the anxiety in their eyes when we get a haircut or visit our favorite restaurant. COVID-19 has hit them hard. But in Ontario, they have responded with resolve and resilience. They've adapted and provided safe experiences for their customers and employees. These necessary public health measures we have outlined today will create new challenges. But as we committed in Ontario's action plan, Protect, Support and Recover, we will continue to be there to protect jobs and support employers. As Premier Ford announced, we will double the money available to support employers affected by the necessary public health measures we are taking to protect people from the second wave. The $600 million we are providing will help businesses cover fixed costs associated with energy and property tax bills. The additional resources we are making available for affected businesses today is why we set aside contingency funds in our budget, ensuring that we can respond to the needs of the people of Ontario as the pandemic unfolds. Applications open this Monday for businesses in regions that were already designated either as modified stage 2 or the red control zone. Money for these businesses will begin to flow next week. Any eligible business in a region in Ontario designated as in the red control zone or lockdown today can apply starting Tuesday. These rebates cover the entire length of time that a business is required to temporarily close or significantly restrict services. I urge every eligible business owner, whether you're in Peel, Toronto, as well as York, Hamilton, Halton, and now Durham and Waterloo regions, to apply for this support. And even though Ottawa is no longer designated as a control area, eligible businesses there can still apply for a rebate to cover the period the region was under enhanced restrictions. Visit ontario.ca/COVID support to apply for relief. Again, if you are a business owner in Peel, Toronto, York, Hamilton, Halton, Durham, Waterloo, or Ottawa impacted by the recent public health measures, visit ontario.ca/COVID support. Now, I know you have a lot in your minds right now, so if any of you have questions, please call 1-855-216-3090. Again, any affected business owner that has questions, please call 1-855-216-3090. I just this afternoon spoke to the Deputy Prime Minister, and I congratulated her and the rest of the federal parliamentarians on passing legislation yesterday that enables the new supports, including the Canada Emergency Rent Subsidy, to be available to employers in Canada dealing with a second wave. And I'm pleased that Prime Minister Trudeau announced that applications for this vital program will be open next week. Ontario will continue to coordinate with the federal program and our federal partners to cover more fixed costs for businesses and ensure relief is available in the most straightforward and seamless way possible. These rebates for fixed costs are an important and immediate way our government is supporting businesses, but it's not the only way. We're also providing $60 million of grants to help small businesses with added PPE costs. Small businesses should visit ontario.ca/COVID support to access that grant. With the federal government, we're providing $57 million to bring businesses online through the Digital Main Street program. We also recently announced reduced property taxes, payroll taxes, and electricity rates to support employers now and in the future. While these necessary measures we are announcing today are a very difficult step in our response to COVID-19, the challenges of a second wave will only strengthen our collective resolve to defeat this virus. To the people of Ontario, as you continue to do your part, we reaffirm that we will continue to do ours. Thank you very much.
We'll go to the phones for questions. First question, please.
First question comes from Natasha MacDonald at Radio Canada. Please go ahead.
Hi, Natasha.
Hi, Premier. What is your government considering for the holidays? As you know, Quebec released a clear framework yesterday, 10 groups allowed from the 24th to the 27th, as long as they isolate before and after. Why isn't your government providing the same clarity today, and what can Ontarians expect?
Well, over the next few days, we'll be rolling that out. So just bear with us. We're working with the public health table right now.
Follow up?
Can you give more details about fines, penalties? Will you bring down the hammer if people don't listen to these restrictions, abide by the lockdown?
I don't like, Natasha, using the word bring down the hammer, but, people have to abide by the regulations and the guidelines set forward by the Chief Medical Officer of Health. This is the only way we're going to get through this. I know it's difficult for everyone. What we're doing everything we can to avoid the spread into other regions. Right now, it's Toronto and Peel. It's absolutely critical we follow the guidelines laid out.
Next question.
Next question comes from Cynthia Mulligan at City News. Please go ahead.
Hi, Cynthia.
Hello, Premier. Over the last few weeks, you have been repeatedly saying that it's people having social gatherings, private parties, whooping it up, that are responsible for the spread. Yeah. What in this is actually going to target them?
Yeah.
It seems like you're penalizing these businesses like outdoor patios, but it's not doing anything to stop the people that will still flaunt the rules and have indoor gatherings.
Yeah, we put forward the largest fines in the country of $10,000 for anyone who's holding large parties. As Minister Elliott just mentioned, the fines are $750 per individual. But Cynthia, I'm really hoping in this crisis at this point that people are actually listening. And I truly believe even in Toronto and Peel people, vast majority of the people listen to us, but it only takes even 1% of the population not to listen, and it starts spreading throughout the community. So I'm asking everyone, please, just follow the guidelines. That's all we're asking, and we're going to get through this.
Follow up?
Okay, can you say how long you expect these measures to last? And as my teenage daughter just angrily remarked in the background, so I can go to school, but I can't have one friend over in my house. Like, how do you justify that?
I fully understand, and tell your daughter I apologize, but this is for the health and safety of her grandparents, for you, Cynthia, for me, for everyone. I'll pass it to Dr. Williams.
Well, it's a good question, and thank you to your teenage daughter for raising the issue, because at this time we have seen, especially in some of our areas, the 14 to 19 age group coming with the highest rates recently, and we're concerned about that. That means we know they can do their part, have to be really careful, really use the virtual tools that you're so adept and excellent at using. Connect on that. You have your time sometimes if you go to the school for your in-classroom setting with masking and other procedures. So it is a tough one. If we do this stringently, and if we can back off this will be great in that. But I think it's the youth and that they can do it. I know they have done it before, and they can do it again, and so we have full confidence. And their ability to use social media and other methods, they outshine us all. So I think they can make that connectivity really well. But it's not easy, but we ask them to hang in and do their part too. We're all in this together.
Next question.
Next question comes from Brian Lilly at the Toronto Sun. Please go ahead.
Hi, Brian.
Hi, Premier. I understand it's your birthday, and you're not excited to be announcing this on your birthday.
That's for sure.
But nobody's excited to hear about it either. Still, happy birthday.
Thank you, Brian.
I wanted to hear primarily from Dr. Williams, but if you'd like to comment as well on data. The province of Alberta has started to release data on the average
that list and exactly what we can be doing as a city with their support to help people who need help the most. And so I think it is very premature to conclude they're not going to provide us with this help. In fact, I think